Right. So impact to other stakeholders, impact to hospitals, impact to specialty physicians. Is there downstream problems for other stakeholders here?
Well, I think certainly if I were a primary care physician, I'd be worried. As a specialist, perhaps not so much. As a hospital, depending on how much I've invested in primary care, plus or minus.
Right. The hospital's no longer next to the Walmart. That's not the new version. You go in, you
Not
get your
now.
groceries, and if the scale, and they check your A1C and it's not right, and you actually move next door. Not yet. Future?
Not yet.
Maybe.
Anything's possible.
So that takes us, I guess, to a place where kind of begs that question of if we look down the road 5 years, because all of you have crystal balls and you're so good at this. Is this going to be one of those just waves that we talk about? You know, I think about, again, we started earlier in our talking about the history, and we had all this practice management companies, and they all went away. None of them survived. I'm not sure none of them survived, but most of them didn't survive. Is this a wave that is successful, and is it transformative? And 5 years down the road, what do we see differently? Is it too soon? Is there enough data that we're going to know anything different in 5 years? That vision that Mike creates of this change in chronic disease management, does it happen or does it not happen?
I think it does. I think it happens. I don't think that this is going to go by the wayside, and mainly for the reasons that we've been talking about. We never, 15, 20 years ago, the data capabilities just weren't there, and now they are. There's the opportunity to make this incredibly efficient based on data and to actually reduce costs. So I actually think that it is transformative, and it is not going away.
The other piece of this is, and I know that we'll be talking about this at some point a little bit further on in the conversation, is the large employers who pay for most of the health care in this country have a vested interest in this. And we're starting to finally see in all these innovative relationships and constructs. And the fact of the matter is that it's, for many companies, it's the single largest line item in their budget is paying for the health care of their people. And they have a vested interest in removing absenteeism, presenteeism, having a healthy workforce. And so we're starting to see the payers start to have a voice. And I think that will continue to drive, as Dana said, this wave.
But for this to occur, it's a good story. It's an interesting, fascinating, cool story. I have become so cynical that anything can get done in 5 years. We have to recognize that there's a couple things that are going to have to happen for this to actually really catch on. Number one, we're going to have to look at health outcomes and
Absolutely.
document that this model, in fact, represents an improvement in health outcomes, ideally across the population. That's number one. Number two is we have to obviously pay attention to the cost. So it's funny, when I was at Aetna, when somebody came to me with what they thought was the greatest new idea, I would always look at it through the lens of, is this just going to be another add-on cost? So for example, patient brings their kid to a member brings their kid to Walmart, ear infection, mom isn't happy, she goes to the pediatrician tomorrow. That has accomplished nothing. It's really accomplished nothing. I think that there are major challenges. Interoperability and transfer of medical information between physicians who have ownership over the management of that patient and these they're almost direct to consumer kind of opportunities, needs to be resolved. It needs to be solved quickly. How this gets packaged into a benefit as it's sold to the self-insured plan sponsor or to the individual member, that needs to be sorted out. How do you price it? All that other stuff. So I think there are huge challenges to this moving forward, but in terms of concept, I think it's really interesting. I really do.
Yeah, Mike, I agree with you. There are major challenges, but I think that some things won't change. I was speaking to a payer not too long ago, and we were just talking about site of care shifts, and specifically in oncology. And he said, all oncology, and we were talking about infusions, are going to be given in the home by, 2028. And that, makes you pause, but that's 10 years from now. And if you think about that, especially we are, our rising population are millennials. They like convenience. Maybe that's a little bit of a lightning rod to mention millennials, but it's very true. Like it is much, much more consumer oriented, and I think healthcare has to go in that direction. Not to say it will not be challenging. I think it absolutely will, especially when you think about our administration and the challenges that we have there, which is a whole nother topic about difficulty. But I think it has to get there. Whether that's 5 or 10 years, it's going to get there.
Now, there's another element here that could significantly impact moving this direction, and that is that the doctors hate it. I mean, they are so incredibly intimidated that this kind of merger is going to do nothing but empower the health plans to exercise increased leverage on their day-to-day life. That I can already hear Barb McEnany in the back of my head, what she's going to say about this, because I know what she's going to say about this. And I think, in fact, the AMA has come out strongly against the Aetna-CVS deal. So physicians could make this, they could make it really hard for this kind of thing to happen.
They could, but at the same time, look at who our largest payer in the market is. It's the federal government, and we have a hard time pushing back against them.